Hello there! Today I'm going to be talking about something that is a bit more sensitive and a bit more close to the heart for myself. It's related to my keloid scars. The reason I want to talk about this is because I know that I've done countless hours of research into treating keloid scars. And these are a result of having acne, or at least mine are, so I've done a lot of research into acne, and you might have seen my other acne related videos about things that I've done to try to improve my skin, like cutting out dairy, which did improve my skin, but I continue to have skin issues coming in and out because I think your body's always changing. So I actually have a quick tip for that I've recently experienced, and obviously the point of these videos is to not give you a solution. I am not a medical professional. I did not study dermatology. I've done a lot of research, but I'm not a licensed professional giving out professional advice. But what I am giving out is advice that I have learned from my own experiences that I want to share, because I think in a lot of cases when it came to my experiences with dermatologists, I didn't have good ones, and I almost had to become my own dermatologist, just like I'm sure people have other situations where they feel like they have to be their own doctor, because these dermatologists and doctors, they're not perfect. They're human like you and I, and they can make mistakes, so you have to be listening to your body, listening to your skin in order to make the best decisions for you. On top of all that, I want these videos to be ideas, things that you can try, things that could benefit you, because I know that's all I ever wanted in doing my own research, is just something that I haven't tried that's going to give me some hope and possibly make a difference. And these things that I'm about to tell you have done that for me, so that's all I can speak to. So I first wanted to talk about a recent tip that I can give for dealing with just adult acne. So I had been getting breakouts a ton. I was getting them all throughout the winter, and I was just getting so frustrated because I was cutting out dairy already for a while now, and then I was drinking apple cider vinegar. I was making sure to follow these other things like switching detergents, and I think all of these things ultimately do benefit me, but they were not changing my acne, and it kept coming back. I kept getting bigger cysts, and I did go on not Accutane, but the other form of it that's not Accutane, but it's essentially does the same thing. And I had read that around 25 or 26, people who were on it when they were teenagers, their maybe larger cystic acne started coming back, and that's what I have. I have cystic acne that can be very severe and be very large on my face. So in wanting to combat it, I was talking to my boyfriend, and we were discussing things that I just was not paying attention to as much, and something that came up was my pillow. So I'll admit, I enjoyed having the same pillow for a long time. I've only probably had a couple of pillows in my whole life, and that might sound gross to you, but I was washing them, and I was doing that kind of stuff. But things get old, they gather a lot of gunk, and I was going to bed on that every night, and despite me using face wash with 4 to 10% benzoyl peroxide, I'm still going to bed and laying my head for 7 hours a night on something that probably had a lot of gunk and oils just built up from use over the years for myself. So I switched out the pillow and got new pillowcases, and got new bed sheets even, and I'm gonna get new towels as well for after shower to combat those things that I wasn't combating, with food or lifestyle. Sure enough, my skin has gotten so much more manageable than when it was a few months ago when I started making these changes. And I feel better about my skin. It just looks healthier. It's not as aggravated, and I'm getting still some acne, but it's definitely a lot more manageable. So I think that could be something great for you to try if you haven't yet. And I plan to probably switch out the pillow every couple of months, and just not get too tied to one. And if I notice I'm breaking out again, maybe switch that up, because I think this is a huge reason why I was getting such bad acne for so long, because I was changing everything else, that is proven to cause acne. Even sugar I was, cutting out a lot of, and it just was not solving the problem. So seeing the dramatic difference that I have in changing out my pillow and bed sheets, and it is crazy how different it is. So a big win there. So I wanted to share that. And then diving more into keloids. Keloids personally have been the root of so much emotional pain in my life. So many tears, so many, chats with my mom to talk about how ugly I feel, or how much of this weird specimen I feel like, and that will make more sense as I explain the journey of it. And I want to explain the journey in a very summarized way so that I'm not talking for 30 minutes on end, in a way, because I want you to see what I went through and then decide for yourself if you feel you need to take that step, or if you can skip it and try something else. So when I first started getting acne, it was around high school, 11th grade. I started getting big cyst on my back, and although my memory is a little bit fogged in how severe it was getting or what I was doing to manage it, I would say that I was popping them because they are so big and they come to a point where they can be popped, but it's just blood. There's not really anything in there. And then sure enough, a keloid started to form, and this was about around that same time, 12th grade, I want to say. And a keloid, it's the way, from all my research, the best way I can describe it is that your skin says there's an injury, let's heal it. Just like, any other injury where you get a scab or a flat scar. But with people who have keloid scarring, their skin doesn't know when to stop. So their skin just keeps sending new skin to this wound or wherever the afflicted area is. And that causes a bump, which the bump can grow outside of the point of injury. So that's why some people with keloid scarring, they get a small injury and it grows into this giant bump that spreads further than the injury, because your skin just doesn't know when to stop. And all in all, one phrase that's really helped me here is that at least your skin knows to heal itself, so it's protecting you. And so I feel better about hearing that kind of statement, because I spent a lot of time hating my skin. But in an effort to combat these keloids, I went to the derm, and I had a situation where I was having cysts and keloids at the same time, and I'm pretty sure the cysts were causing the keloids as well for the most part. So I was getting these round bumps all over my back and shoulders and on my chest, big ones, and I kept going to the derm, and that's when I went on that Accutane but not Accutane kind of drug to combat the cystic acne. I was going to dermatologists all the time trying to combat this. I even went to one place that gave me this laser treatment. I think I got about 4 or so, and it was very painful. It feels like someone's snapping a rubber band on your skin over and over again for 20 to 30 minutes. And that was in an effort to combat the cystic acne, I want to say. And because it was kind of the conversation was kind of around keloids. All in all, I always felt like a test subject when it came to keloids, because keloids are something that are kind of on the more rare side. They typically are known to affect people of African American descent, and not so much Caucasian people. So I feel like they always kind of looked at me like I was this specimen, if you will, that they wanted to see if their test could work. So and when I first started having them, there wasn't a lot of info out there, and on the internet especially, so was always kind of in this guinea pig mode with this. And this one place really made me feel like a guinea pig, and they recently got into an issue because the owner did some illegal stuff, so just saying there. But the reason, but they kind of were doing this laser treatment, and it really wasn't working. So a lot of money spent on these treatments that really didn't seem to help much. And I still had my scarring because these were specifically just for the cystic acne. Sure enough, I think with all those changes that I was making, like the dairy and now with these sheets and stuff, my cystic acne is not as prevalent, and I've learned to just not touch them. Do not touch them, do not aggravate them. Sometimes, they get hit and it hurts and that might cause some issues, but essentially don't let it be an open wound is the goal. And I know it's hard. I've been through that. So different steps I took were, the Accutane thing to try to prevent the cysts from that were causing the keloids, this laser treatment. I even got the Fraxel resurfacing to try and help the keloid scarring. I also got microneedling done. So I went through the ringer in terms of helping. Microneedling worked with an amazing person who wanted nothing more than to help me. She was just a godsend when it came to that point in my life when I was feeling about myself and just hitting brick walls all the time with how to treat my skin. She did the microneedling on me a couple times, and it really helped any divots I had, which were, divot scarrings where there's a little indent in your skin from something like a cyst coming. And that didn't help the scars as much though, the elevated scars. But the thing that finally helped these keloid scars go down was I went to the dermatologist, and I remember the day very well. I was getting the steroid injections. What was different about this time is that they said, oh, you're getting these steroid injections at the week level. Maybe we should try upping the strength. And in my head, I was like, there's a different strength to try? And I noticed this trend in dermatology a lot of and with doctors too, of they're gonna give you what they recommend, but it's you kind of have to push for something more or something different to try because they have only their own experience to go off of. I said, well, yes, let's try the stronger one because this other one isn't working. And mind you, steroid injections were something that I had read a lot that could help it, but they were kind of oh, there's only a 40% success rate, but only a 40% chance of them staying flattened after you inject them. But I said, let's just try it because we tried literally everything else to combat this. So let's just give it a go ahead. And it worked, which blew my mind. And you have no idea how much it affected my mental health on my skin. So the actual terminology is that we were using Keloid 2, I think was the strength that we were using. And we needed to try Keloid 40. So the difference in numbers there shows the difference in strength that you can get with a steroid injection. The goal here, though, to be mindful of is that you don't want to inject so much steroid serum that you create that divot that I was mentioning before. So it's all about time, which it takes about, I would say, a couple months after you get an injection to see the full impact of it. So you shouldn't go more than, the frequency of every quarter of the year to get injections if certain keloids are still raised, but it's amazing because I kid you not, had ones that were bump off my skin that much, and they were now flat. And they started to blend more into my skin color as well, because if you deal with keloid scars, I'm sure you're aware that they're red and they can be, different color than your skin. So that injection started making them blend more into my skin. And some of them, I will say, I would go and I would notice some of them raised up a little bit more after going down, but that's just that 40% that I mentioned too. But you have no idea how excited I was and so happy that I'd found something that actually made these bumps go down because, like I said, we just kept hitting brick walls. So I went every 3 or 4 months, I want to say, and honestly, I think at this point it's going to be a maintenance thing where most of them have flattened out and most of them have started blending into my skin color, which is amazing, and especially the ones on my chest. I had some bumps on my chest and they're flat now, and you can tell there's a little bit of discoloration there, but I have chest hair, so it kind of just hides it. But it's crazy because I remember the first time I got the injections, they were like, okay, we did about 30. And now when I go, it's like 4 or 5, just to kind of like fine tune, if you will, too. And I will say that keloid injections, if you have insurance, I think I paid, last time I went, like 30 or 40. When I didn't have insurance, I think it was, I want to say it's like 80 for an appointment and then like 40 or 50 for the injections. But considering the other things that are available out there, like microneedling, like Fraxel resurfacing, this is the cheaper option to go, and it's the one that actually worked for me, which I think is a huge sign of hope for anyone out there who has keloid scarring as well. But that was a mouthful. I just wanted to speak through all the experiences I had. Apologies if I blew through some that you wanted to know more information on. Feel free to comment below. If there was something that I talked about that you want to know more about. I am all for sharing this information that I've gathered over the past decade or so, that I've been seeing, a dermatologist and researching ways to improve skin and from things like cyst, acne, and keloid scars. I want to do nothing but share that wealth of information with all of you. But thank you all for watching, and I hope you have an amazing day.